Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Sonal Sharma with us. She's here to discuss a very important topic about NEET Pg, how overwhelming it is, what are the three most important points that you should follow to clear your NEET Pg, something about her experience of clearing NEET Pg, and how did she get along the whole process. So welcome, doctor, to the platform. It's really nice to have you here.
Yeah, hi Ayushi. I'm really happy, and I feel like I feel really honored to be here and talk about this because as I have gone through the same process myself, I feel I can the way I tell my juniors what to do, like same way I can just tell all the people out there, like all the needs aspirants.
Yes. Thank you so much for taking out time. So let's start with a brief about your journey. How did your journey with MBBS and to going forward started?
Okay, definitely. So hi everyone. I am Dr. Sonal Sharma, and I am a pediatrician. And my journey started in 2011 when I got into MBBS and from Jawaharlal Nehru Medical College, Belgaum. And then I completed my graduation in 2016. Then I did my 1 year of internship, and then I joined MD Pediatrics in Rohilkhand Medical College, Bareilly. And now I'm working as a pediatrician as an SR in ESIC Medical College. Okay. And my job is eventful, I should say. So that's enough about me, I guess. We can just go on to you and let them know what they need.
Correct. Completely agreed. So let's jump into the topic without delay. So now starting with how you have cleared your NEET PG, and it's NEET PG is around the corner also right now. So what do you think, how overwhelming it is? There's a lot of stress with the continuous postponement also, and otherwise also, to cover up the whole syllabus and everything. What do you think, how can students actually get over this feeling of stress or overwhelm? What is your suggestion on that?
Exactly. So I guess for this question, I will really like to put myself in the situation again. If it was me again, now the situation is just not the same as before. Like we gave the exam, it's not the same situation. So if I was in this situation, how I would like to go about it is that first of all, it's overwhelming. 19 subjects in 1 year, it is overwhelming, and overwhelm is the normal response a student should get. There is nothing wrong with the overwhelm, because I got overwhelmed. My friends who have done really well, everybody got overwhelmed, and they all got a decent rank. So for the overwhelming thing, what I like to, what calms my mind, I think, it will calm everybody's mind. Because, we function at the same level, we're all humans. So what happens is, when a student decides that, after 5 years of MBBS, 1 year of internship, that person wants to pursue NEET. There are different options, NEET, LAB, and USMLE. But if somebody has decided to stay in India, which is good for us, so he or she decides that they have to give NEET. But the overwhelm, there are 19 subjects, they have to be completed in a year. Maybe you can take more than a year. No doubt about that. You can take 2 years, you can take 3 years. Take as long as you need. But to really understand this, we should go about it this way. So there are 19 subjects. Okay. And there is one exam. And you have been studying these 19 subjects, not just now. You have been studying, you're an MBBS student. So these 19 subjects are not new to you. You've been studying them since the day one of MBBS, first year. First year something, and second year, third year. They are the same subjects that are just going to be in the exam time. And now you have to prepare for that exam. And so to avoid the overwhelm, what I would like to suggest is first understand the exam pattern. Like instead of studying the subject, study the exam pattern more. because you have already studied the subject in those past 5 or 6 years. So currently the exam pattern, right, it has changed. Pehle kya hota tha? It was 300 questions and it was not clinical questions. It was like what will be the value of bilirubin in this condition, like exact, like something to memorize. It was all like mostly half of it was maga. But now NEET has given us such a good platform that they have converted this to clinical. So what does clinical mean? Like I see in my OPD every day, a patient comes and like I'm a pediatrician, so a kid comes with fever, like breathing difficulties. His HB is this, his RR is this, chest X-ray shows this. So these kind of questions will be seen, and the students are getting overwhelmed. How will we perform in the clinical? This is the best thing that if they can actually when they actually become a doctor, like the NEET, they become a specialist. This is what they are going to do. This is how the clinics are going to be. So this NEET is just an imitation of that. So for that, what they need to do is there are 19 subjects. So they need to study that what is important. Pehle, the pattern was that there were certain subjects which were more important and certain subjects which were less important. Like people would say, read PSM more, read gynecology more. Like my seniors told me, read gynecology more, read PSM more, read medicine, surgery, all these bigger subjects more. And also like at the same time read the smaller subjects. But right now the pattern is clinical, so it's not sure कि कितने questions कौन सा topic में से आएंगे. It is not sure. Nobody knows, and that nobody needs to know, because if you study the whole pattern and a question comes, so that question will include everything from medicine. It will have some investigations from pathology. Then it will have some treatment from pharmacology, and it might have some preventive role from community medicine. So the whole exam has become more clinical, which is good for the students. So what they should do is they should try to reduce the stress, answering your question, coming back right at the point, to reduce the stress at the time. What I did.
Yes.
Yeah. So what I did was I imitated the exam day again and again in my head. Yeah.
Yes.
Audible? Yeah.
Yes.
So what I did was, sorry for the interruption. Yeah. So what I did was, I imitated an exam pattern again and again in my head every 2 times per week. So those 3 hours, right? In the exam time, you will be giving the exam in those 3 hours. So how much you study the 19 subjects? If you are not able to reproduce that well during the exam in those 3 hours, it's useless. Maybe you're a topper, maybe you're not a topper. I have seen people who are not toppers, but they performed in that 3 hours pressure best. And they got ranks, they were better than the intelligent students. So if there is a stress ahead, what we do is plan, right? So plan that thing beforehand. Plan that every week, at least 2 times, we'll be giving an exam, the tests, that narrow. There are so many platforms. They all have tests. So what we can do is we can give tests every week and imitate the same environment. We can be like, we can just shut ourselves in a room, not copy, not open the books, just imitate the same exam, give the exam, analyze yourself, don't compare yourself with your friends, and compare your growth every next test. This is what I did, worked perfectly well. I got a decent rank. I'm a pediatrician now. So this works really well. And this will take care of all the overwhelm and the stress that is coming along with it. And if somebody wants to know how to plan the day, timetables, and like the whole thing that we do, then they can DM me. I can personally tell them like what to do, what not to do. But on a broader platform, I think this is something that works. So that's answers.
Yes. No, that definitely answers. So now when you have mentioned about the new format, which is related to more clinical part, this is actually, there is some apprehension related to that as well, because with the change in formats, there are times that people are not very clear. So what is your suggestion and, positive side of the format, if you can push that further?
So as I was studying the whole, and I talked to a lot of people who are giving NEET, and I studied because I gave NEET 3 years back, just right before my PG. So I had to really update myself and get used to the whole pattern of it now. So I studied and I asked my professors also who are actively involved in this. So what they said was that you in the whole day, the pattern of the exam in those 3 hours right now nobody knows. So to be very honest and very bluntly honest, nobody knows. Even if somebody is telling you, some professor or some platform, anything, this is the pattern. These many questions will be asked from OBG. These many questions will be asked from gynecology or pharmacology. No, nobody knows. So if I was there, and I had talked with all my friends also, like if we would have been preparing, we would go totally clinical. Like I would increase the ability of my mind to process the question fast. So if a patient comes in, this is like same thing. So if the exam pattern, we have to read the clinical question and reach a certain point where we can process the question fast and think about it fast, because it is really 3 hours and 200 questions now. Before it was 300 questions. Yes. That leaves us less than a minute for one question.
Yes.
So if you don't process fast, you're done. If you don't process fast, you can have the whole knowledge in the world. You can be a topper. You can know every subject like in detail. Yes. But what you have to learn in the process to ace at this pattern in the exam. Even if you are not a person who is very regular or very smart, or you think my friends are better than me, whatever. But if you ace the pattern this time by just being smart about how you perform in this, by processing the questions fast. And how will this come? This will come by reading. When you are reading, think about the question. What are the symptoms? What is the diagnosis? What are the treatments given? And Google a picture about it. Because now the pattern is more into pictures. So instead of just looking at pictures, when you're reading anything, just see the pictures related to it. Like if you're reading some pediatric disease like Duchenne's muscular dystrophy, so look at the Gowers sign. How does the child look? Just an example of my field, and that picture will be. And if you have studied the disease properly, there is no need to study the pictures separately, other than pharmacology and pathology and micro, where you really need to study, because the bacteria, you won't know how the bacteria looks unless you've seen the bacteria. So I will to the pattern.
Yes. No, that was very helpful to understand. So now, as previously we discussed, that there are so many subjects to be covered in a short time. So what did you do to keep a flow, of these subjects, how to cover, how to, go forward with the whole thing, So although there are a lot of classes, going on, as you mentioned before. So do you think those also help, or you should keep your own pace on the go, irrespective of what are the classes going?
This is very important, that you should go at your own pace and not at the pace of your coaching institute. Never.
Yes.
Because see, coaching institutes, they are a business. Okay. So it's their business. Like, no offense against anybody, but it's totally a business. And what is giving a crash course, even if you have 3 months, they'll give you a crash course. You can do this in 3 months and you'll be good to go. But this is not the right approach. You need time to really study and focus on the exam pattern. So what I did personally was, there were so many subjects, and we divide the subjects into large subjects and smaller subjects. So under subjects comes medicine, surgery, PSM, that is community medicine, gynae, obs gynae, and pathology. This is also huge. Then pharmacology and microbiology. So these are large subjects which I consider they are huge and they cannot be covered if I just sit for one day and just finish it off.
Correct.
So I did. I used to plan my day I used to fix my study hours to certain hours, and that depends on everybody. Like I might study for 4 hours and somebody else might just need 2 hours, you know, or maybe somebody needs 6 hours. It depends on grasping abilities.
Yes.
So what you plan your day like that you will cover one large subject in the whole day, one large subject. So for example, if I take medicine, so I'll read medicine in today is 27th, right? Today 27th, I'll read medicine. So along with that, I will just not read medicine. I will read two subjects more. One is a shorter subject, you know, to lighten the load of it. Like when I'm really bored with it and I feel I'm, you know, totally exhausted by this subject. So what I'll do is I'll read about the other shorter subject in between for an hour. And then for the remaining 1 hour, instead of reading, I will use that knowledge. I will get into a practice of applying my knowledge every day.
Okay.
And test, even if it's a subject test. Just to assess myself every day, because at the end of the day, NEET is not about knowledge. NEET is about how well you're able to apply your knowledge in that time. And if you are very knowledgeable and you cannot apply the knowledge in time, then it's of no use. So that's how I plan my day. So a bigger subject, a smaller subject, and 1 hour of question day. You know, that can be questions, that can be discussing with your friend. That helps a lot. Like I discuss with my father, like my father. So I really discuss everything with my father, the questions, and you know, he really helped me with the whole thing. So it can be your father, your mother, your brother, your sister, or your friend. It can be anybody, but that person should be, you know, giving you ideas like how you are going wrong about it, what you should do to improve it, and you can discuss that so that you remember in the exam. That's all. That works. Like 110% that works.
Great, great. Nice to know. So now obviously covering the subject at once, but now currently is the time to revise, you know, because it's just 2 months or 3 months to go, you know, INICT is again there in July, but you know, with NEET PG, things are still yet to come. The dates are still yet to come. So what is your suggestion for the revision part? Because I'm sure most of the students have covered the subject once, but revision is something which is very important. So how do you do that?
So there are two types of students right now. One are those, you know, like one group is those who have just finished their MBBS. They have started with internship and they are fresh out of the, you know, the box, like to enter the medical field. And they are, you know, they are the best candidates to give the exam. They have not studied the 19 subjects because they did not get time. Because, you know, like they just, and because of the COVID situation, their exams were postponed. They just finished. They are just out and to revise first, you need to read first. So they have not anything yet.
Yes.
And they are getting overwhelmed. Should we give the exam or should we skip the exam and give it next year? Because, you know, since we have not studied. But no, again, I'll talk about imitating the exam day. Even if you think this year you'll not be getting the rank or, you know, you've not the effort, give the exam. So that the next year, at least you will be not in the new situation again. You would have been gone through the situation, know the whole scenario, and then you will be able to perform better. And then the second group is who have been studying since past 1 year, you know. So I guess, you know, they must have read their subjects at least twice, at least, you know, if more, twice, at least once till now, because it's 19 subjects. So in this moment, what I'll tell you is, you know, what I did was, if I studied a subject before, I would always concise the matter somewhere where I can revise it in the end. Because if you read a lot, imagine you read a lot about everything and you did not revise. We're not superhumans. We are humans. We forget. So even if you read 19 subjects and you do not revise it in the end, it is as good as nothing. And compared to a person who just read selected topics, revised it again and again, and performed better. So what I would say is, whatever you have studied till now, you must be having it in your head. So just leave the past behind. Sit today. Just recollect. It's just 19 subjects जो नए नहीं है मैंने पढ़े हुए हैं पहले से. Through the process you studied them, and you know, just relax yourself. Because I also felt overwhelmed. यार इतने subjects हैं मैंने कैसे पढ़ूंगी and all that. So and I was an intern when I was giving the exam. So I really felt it. I was like, wow, how will I do it in such short time? So what you do is you sit down, just think about it, make a timetable कि मैंने क्या पढ़ा हुआ है, what I have not read, and just know कि what are my strengths and my weaknesses. जो आपकी strength है, जो आपके subject strong है, वो strong ही रहेंगे. उनमें आप you will be able to answer any day. मतलब इसमें कोई वो नहीं है doubt कि you will forget suddenly कि जो strong था वो weak हो गया. You will need, but your weaknesses will remain your weaknesses, and in the exam day when you're giving the exam you'll be like यार ये question मुझे नहीं आता because I was not like this is my weakness.
Yes.
So work on that. Start today. Make a plan about your weaknesses. Revise your weaknesses. This is for the urgent situation. 2 months are there, so you cannot strengths right now. If you are good in OBG, just revise OBG less. But if you are bad in micro, which I was bad at, I remember micro. I hated micro. I could not do micro. So I made sure I revised it enough to like it. So you revise it enough so that when the question comes, you're like, I studied it too much. Because, when you study, when you are afraid of something, you tend to do better at it just by reading more. So that's my answer,
Yes.
the weaknesses.
Yes. No, that's a fantastic answer. So, there are times that we just run away from the subjects that are difficult, and that is something that should be done, definitely. So now, post that, there are also confusions while selecting branches. So there has been a norm with, with this branch, you should, girls should take this branch, boys should take this branch, if you want to relax, like this branch. If you do not, you want to just work, you are a workaholic or something like that. So what is your suggestion for all those students? Should they have a branch in mind? What is your, or should they just should focus on NEET right now? Or, what is anything from your end in this?
So see, there are two types of people. Again, the students, everybody is not same, right?
Yes.
There are some people who have a certain branch in mind, like there are two types of branches. Just to be clear, medicine and surgical branches.
Yes.
Surgical branches. So if you are open that you want to take a surgical branch, you should not be fixed. I want to take OBG only, I want to take surgery only, or I want to take orthopedics only. You should be open to surgery. You should love surgery. It can be a part, right? It's not like you took like one part of surgery, ENT. So if you get that part only, you will be happy. And your happiness will not be decided by your branch. That's one thing. It's about how you are as a person, how you perceive life. Because as I've gone through NEET, then I've gone through PG, then I'm currently doing my SRship, I face that, more than the branch, what matters more is how I am handling the branch. I might not like the branch, I might like the branch, or sometimes I've seen people, they like the branch initially. When they enter, they are like, I don't like the branch because what comes along with it, they cannot take that. So this is mostly a personal choice that what branch you should take. But my personal take is that if you can take, if you want to take a medicine branch, be open to medicine. It can be dermatology, it can be pediatrics, it can be community medicine, it can be medicine, it can be family medicine. Be open to that. Just don't fixate on one thing and just think that if I get this, I'll be happy. Because NEET or your doctor, being a doctor is not the source of your happiness. Like I should tell you that my source of happiness is not NEET. My source of happiness is, reading novels and yoga, all the other things that are not my subject. So don't base the source of your happiness on it. Your passion can be your subject, but your source of happiness should not be the branch. Just see, how you work in surgery. If you're an action like person who always takes action, and you're fast, you want to just correct things, you don't want to think too much, go for surgery. Perform well. Just don't think too much. Just perform, get done with the surgery. If you're a person who likes to make diagnosis, like me, I love making diagnosis. How the patient came, what the investigation. So if you love to make a diagnosis and go about it, and you feel a little passionate about it, then you go for a medicine branch. But at the same time, be ready to take on the challenges that are going to come with the branch. Because it is not just what you want it to be. It will be a lot of people, a lot of things involved in the situation which will come along with it. So just be focused. I want to become this, and along with it, if anything comes, I'll be good to go.
Correct.
And rest choices totally a personal choice. Like I have this much to say that.
Yes, that's completely correctly said. So there is one more thing that always people have in mind. This is something that happens post NEET. After the results come out, then there are the college and the branch. So which college to take and which branch to take. There are sometimes that you get the branch of your choice but not the college of your choice, and then you want to understand how to balance out that. So what is your suggestion on that? How did you take your decisions?
So you're asking me this question at the right time, because if you would have asked me when I was in my post graduation, I would be like, I still don't know, because as you start practicing in the field, see, study and practicing in the field, like I am like totally practicing in the field right now. Then you realize, things I stressed about before, the branch, the place, everything doesn't really matter. What matters is your patient and you. It doesn't matter. So right now, I feel that the place, see, for me, I personally feel the branch, right, that's more important.
Okay.
Because I'll support my statement with the fact that, if I want to do something, the branch is really important, because that's going to stay with me for my whole life. Unless I am, that person who might, change the branch, like if I don't like it, that kind of a person. But that's going to stay with me for long. And for that to stay, I really need to like the branch. I might finish off my course from any college, and from a private college, from a government college, from AIMS, from PGI. If you're really amazing, then I love people who who are doing it at PGI. Like, I think, oh my god, they're good, they're amazing. But I also like what I'm doing. I'm practicing my own private practice, which makes me happy. So eventually, your branch is going to matter. Why? Because your college is just for 3 years. It's not it's not a short time, but it's actually in life, when you look back on it retrospectively, it's just 3 years.
Yes.
But this branch will stay with you forever. You will be like, next to my name is a pediatrician, so you are a pediatrician. So if that stays with me, I'm happy about it. So I guess instead of the place, the college, the branch is more important. Definitely, you should look for good colleges, because it's best to learn from the best. If you're in AIMS, you're learning from the best, which everybody would like to do. But to just focus your whole life, I'm gonna go to AIMS only, and only if I go to AIMS I will be that good. No, you can go to any college, finish a degree, finish diploma, finish DNB, finish MD, finish MS. Don't worry about the tagline that's there. I've done diploma. I will not take diploma. I will not take MD. I will not take DNB. Don't focus on the tagline that comes along with it. Because if you really work on it, you will succeed with just MBBS also. But since the scenarios are developing now, and we want specialists, so we should be doing the super specialty or specialty.
Yes.
But you will be just fine if you are focused on your branch, no matter diploma, no matter DNB. I have seen everybody working very well in all the fields, earning money and saving lives. That's what we want to do, right?
Correct.
Our purpose is seeing the patients, and other things comes along with it. So branch should be important, and never ever focus on what course are you taking, diploma, MD, MS, what you're taking. Don't focus on that. Focus on what you love, because if you're doing what you love, eventually everything will fall in place. You will feel more confident.
Correct. That's so correctly said. So this was also one thing I wanted to ask. People are very much not very clear in taking diplomas. So what is your suggestion on that? So thank you. You answered that question.
I did not get your question.
So you have answered one more question of ours. I wanted to ask that there are people who sometimes do not want to take up DNBs. So and are like we want to do masters only, and they actually at times work 2-3 years to clear the NEET PG, and still, there are times that they are not able to. So what is your suggestion for that? So this is something that.
Good. You asked me this question.
Yes.
Okay.
Yes.
So, my suggestion is that, imagine that I'll just take you 10 years down the lane. Like I always answer myself 10 years down the lane. So I'll just take you 10 years down the lane. Imagine you're 40. Like I'm assuming you're 30 right now. Just, like medicals, they get 27, 30 by the time they're giving the exam, which is still young. So imagine you're 30 right now. And 10 years down the lane, you'll be 40. Just think of looking back at the question that, what would you love yourself to be? It matter that you've done your diploma in child health, or you have done your MD in child health, or you have not done anything but started your own private practice and you are doing really well, or you have, started teaching. You've done diploma, you've done secondary DNB, and you have done, amazingly well in the teaching profession. So what would matter at that time, 10 years down the lane, when you are sitting in your OPD, what would matter more? Will your degree matter, or what you are treating will matter? Your degree will not matter as long as you're very active about it. You are working. Personally, मैं हमेशा सबसे एक question पूछती हूँ, because when I was a postgraduate, it always troubled me. Some people were better academicians and some people were better clinicians. I'll explain. So there were some professors who would teach amazingly well in the class. They were like, this is the thing. They were very good academicians. They were teaching. They were well, but they did not have good OPD patients. When they sit in the OPD, they were not getting good patients, and the patients were not, liking them, and the patients were not, that was not their field of work. Their field of work was teaching, and other people were very good clinicians. So, and whether it be diploma, whether it be DNB, I have worked with everybody. Okay, everybody. I have seen one of my colleagues. He's done his diploma in child health from some college, and now he's practicing his own private practice, and he is quite successful. And he's keeping MDs in his hospital as for the working thing. People who have done MD are working in his hospital, and he has done diploma because he just got that because of the rank, and he did it. He did not judge the diploma. He did not, because as interns, initially we judge.
Yes.
We judge a lot. Like subconsciously we judge. Even if we don't want to, subconsciously we judge. So that person is doing really well, and he is employing MDs in his hospital, and they are working under him. So he chose to be a clinician. He chose to open a private hospital, and get good at it. So that answers the question. If you are a person who is amazing at the private thing, and you can work really well, you don't want to be an academician, choose what you love. But if you want to be an academician, if you want to go to a medical college, then you need this MD, the degree, to get higher in the field, like you become a SR, you become an associate, then you'll become a professor. So that helps you with the teaching thing. So if you are into teaching, definitely look into that. But if you are like me, totally a clinical person, I would not care right now at this stage if I was allowed to give NEET again for the degree I'm getting, because I know what I love to do, and I will.
Yes.
So answer the question is academician or clinician.
Correct. Great. So now, as you also mentioned in the interview before, that you started preparing in your internship period itself. And many students do that. So internship, I believe, is an important part of MBBS also. You practice without any pressure, without any studies pressure, because, otherwise till fourth year, till the last year, there is a lot of pressure, on you. So how do you, but then preparing for your NEET PG is also another pressure, it's a bigger one. So how do you manage your, internship doing well, and then NEET PG, and then, clearing NEET? How did you do that?
For me, what works, everybody is different. For me, what worked is even in my MBBS, I'm not a hard worker, I'm a smart worker. But this is what I believe. Yes. So I have good, when I read something, I just don't read it to give the exam. In MBBS, when I was reading things, my main focus was not कि मुझे exam clear करना है, मैं इसलिए पढ़ रही हूँ. My main focus was कि since I love biology and I was, I love the science of behind it, so I always went into deep depth. Ki, okay, if there is a pharmacological drug, what are its actions? So I always went into depth of the topics I loved, or maybe the topics I loved were important. I went into depth of the topics that were very important. So to really perform well in internship, मतलब मुझे ये लगा कि I had good concepts before. It's like not like I'm bragging about myself or something, but I felt that maybe I did not I get rank 1, but I knew what my strengths are. And जो मैंने पढ़ा हुआ था, I was dead sure कि आप इसमें से कुछ भी पूछ लो, मैंने ये पढ़ा हुआ है. That is I'm good at. So that helped me कि I did not have to cover those subjects जो मैंने पहले अच्छे से पढ़े हुए थे. Only my weaknesses were micro. My weaknesses were biochem. My weaknesses were, I guess, pharmacology was my strength. So I had some weaknesses. So in that internship time, I told my friends, I told my family is very supportive in this. So I told my family that these are my weaknesses. Like my father is a doctor. So I told him that, these are my weaknesses. So let's work on my weaknesses. In life also always work on your weaknesses. So I worked on my weaknesses. I read micro PSM. PSM was my weakness. I hated PSM. So you work on the weaknesses. As an intern, what I did was I divided my time, and I have really good friends, seniors, friends who, like one of my friends is doing DNB radiology in Delhi, and he counseled me amazingly well about everything, So, he got a good rank. His rank was 2,500 something, and he chose DNB in radiology in Delhi. Than choosing, and he left MS. He got MS surgery. He left MS. He got chose DNB surgery, DNB radiology in Delhi. So there the importance of the branch, not the degree. Yeah. So focus in the internship time. Focus on your weaknesses. Make a plan about your weaknesses. कि ये मेरा weak है, because जो आपका strong है, वो you'll remember. You're fresh out of the MBBS thing. You will remember the stronger points. Make a about your weaknesses. Give as many tests as possible. That will give you an edge over everybody. And be confident that I am better than everybody. Like, just don't think कि उसने 3 साल पढ़ाई की है तो वो उसको ज़्यादा आता होगा. नहीं. कोई 3 साल में भी पढ़ के भी they are not able to reproduce as an intern can produce. At the same time, some people perform better with, later on also. It's all like that. So since I have done it with my internship, so I know कि you are best prepared when you are an intern, because you are mentally fresh. You are a clean book. Okay, anything that's written on a clean book, it will be remembered well. So your mind is plate. You don't have misconceptions. You don't know what is it. So whatever you feed your mind will be fixated, and you will perform well in the NEET exam. After 2 or 3 years, what happens is, if you don't plan your studies well, then you might, there are 2 scenarios. If you study for 3 years, either you'll get pro at it and you'll get an amazing rank. I have friends like that who became pro at it in 3 years. First year, they studied the exam pattern. Second year, they chilled a little, they studied a little. Third year, they just studied and they got good ranks. Other people perform like me. I performed in my internship. So it is definitely, and I have seen people at 35 years of age, female with kids, performing as good as I have performed. So it's not like just interns perform well. Everybody can perform well. I was like, how did she get the time to study well, with the baby and with everything? But, we are very strong. Like, if we make our mind on it, we are medicals. We are very strong mentally. Like, if you give us subjects and some time and some good food, we can do it. And some coffee. Yeah, we can.
Yes, that's true. So, that's really helpful to understand. So now understanding, one very common question with the current internship students are that with the COVID scenario, there is less of clinical exposure and the whole exam is more on clinical base. So maybe that is also something that adds to the apprehension, but what do you suggest to them?
Okay, so you mean to say that they're not like getting exposed in the clinical area as much as they should? No. See, what happens is NEET has now become like this. So I know the medicals, right? They've already been watching TV shows like House, there's Grey's Anatomy. There are so many TV shows, which are clinical. I'm not saying watch them. I'm just saying that the pattern in USMLE lab has always been clinical. It's just that India is now getting more clinical now, but the world has always been clinical. So what they do is they can read the USMLE clinical scenarios. USMLE books, they have clinical scenarios about how a patient came and what are the diagnosis and what are the treatments given, and this is the thing. So NEET में भी यही पूछा जाएगा कि एक क्लिनिक में एक पेशेंट आया, उसको ये सिम्टम्स थे और उसका क्या है. तो अगर आप चाहिए तो there are so many clinical books जो आपको material provide करती है. Secondly, you can go to USMLE books. You can borrow them from your friends, because my best friend is she cleared lab and she is a female doing orthopedics. That's right. So you know, you can just focus on the clinical scenarios. Books aati hain. I can give links about those books in my messages. And USMLE के pattern को study कर सकते हैं. And secondly, discuss friends के साथ scenarios बताओ. I got a like I was discussing with my JR in the OPD recently. So I gave a whole summary. There's a 3-year-old female with acute gastroenteritis. This is the treatment given. What is your answer? So you know, make scenarios like that, because this is what will be asked. Nothing new. It's all like pediatrics में जैसे मैं बताऊँ तो ये Duchenne's muscular dystrophy, pneumonia. These are very important milestones. इसमें कुछ सोचना ही नहीं है. एक patient आया, वो he did not cry at birth. उसको CP हो सकता है. You know, it's like catch the question, read so that you're able to catch the questions fast and read clinical scenarios and discuss with your friends.
Correct.
And professors, they can give you good ask the professors. They will be very sweetly doing it. Make some clinical scenarios for us every day, and I have seen in my OPD my professors were doing that last year. So I have one of the ma'am, she used to make scenarios and then give the exam. So, and I have given my MD exam with that same scenario. Like a scenario was made up and we had to give our MD exams like that, and it was on video conferencing. So if that is possible, then you studying for clinical scenarios is definitely possible. Don't underestimate yourself. कि मुझे नहीं पता. You know everything. Just process fast.
Great. That is really helpful. So now, you know, understanding some basic important points that you would have given to your younger self, something that for the current, you know, students who are preparing for postgraduate, some pointers that you want to give them.
Okay, so I would have given to my 3-year-old younger self, right? So what I would have said to that person would be, first of all, this works. This worked for me. This now it works for me. But that time I did not know this. So for my MD exam, what I did was I realized that, you know, since I have chosen to give this exam, like the same way the NEET people, NEET aspirants, it's their choice. Nobody has compelled them to give NEET. So it's a choice they have made for themselves. So they here on whatever time, whatever they have. So they should prepare in a way that when they look back at it बाद में, they should not feel कि मैंने वो time पे पढ़ाई भी की और नहीं भी की. मतलब either you go all in or you go all out. That works for everybody. अगर आपको prepare करना है, you have devoted, you have made up your mind, your family has made their mind कि आप एक साल prepare कर रहे हो, तो do not get distracted by emotions. Do not get distracted by social media, breakups or anything. Because if you have decided कि मैं NEET दे रहा हूँ, everything's gonna happen, and it's not like कि अभी even in PG life your exam will not be all good. You will have the problems, but amidst all that you have to give the exam. So be mentally strong that मैंने ये एक साल devote कर दिया है, अब मैं पढ़ूँ ना पढ़ूँ ये एक साल निकल जाएगा. But later on when I look back at this time, मुझे ये लगना चाहिए कि at least जो मैंने try किया, जितना effort मैंने put किया, वो rank मेरी आई. At least you should, good insight you should have कि इतना मैंने पढ़ा था उतनी मेरी rank आई. So this insight is important. I would tell my younger self that you will get a rank that you deserve. So make sure you deserve better. How? By planning, by reading, by staying mentally strong. Yes. Second, I totally focused on NEET, nothing else. I would tell my younger self, exercise. Like, even if it's 20 minutes a day, 20 minutes के लिए just do some yoga, do some aerobics, walk, do some meditation, do it, because that takes your mind off of everything. And the other things, do something that you love. Like if you are studying for NEET, ऐसा तो नहीं है आप 24 घंटे वहां पढ़ोगे. You will study, इससे ज्यादा कोई नहीं पढ़ सकता. ठीक है, प्रैक्टिकली स्पीकिंग अगर कोई पढ़ता है तो वो नहीं पढ़ पाता उससे ज्यादा. 8 hours से ज्यादा आप नहीं पढ़ोगे. तो you in the remaining hours, what you do is you study. You instead of studying, you work out, you eat good, you plan your day well. मतलब ये सोचो कि आज का दिन ही है, मतलब आज का मैंने अच्छा परफॉर्म किया तो नेक्स्ट डे भी मैं अच्छा करूंगा. And also learn from every day. At night when you're sleeping, journaling helps. Right now I journal a lot. I never used to do it back then. So at night when you're sleeping, 20 minutes, just 20 minutes, instead of studying more, just sit down, just see कि मैंने आज का क्या प्लान बनाया था, क्या मैं नहीं कर पाया. Don't beat yourself कि यार मैं नहीं कर पाई, मैंने प्लान बनाया था and I'm lacking at it. I used to do that. I made a plan but I did not do it. So just look into your mistakes today and use them tomorrow instead of बाद में कभी use करने के. आज देखो कि आज क्या mistakes हुई, क्यों नहीं पढ़ा, क्यों नहीं mentally आपको fit feel हो रहा था. Work on them, use them the next day. So basically analyze your work every day and then go about it. I guess that the analyzing thing is important. Exercising is amazingly important and ये भी important है कि यार देखो 1 year है, हम लोग medicos हैं, तो हमें हमेशा एक FOMO होता है. There's a fear of missing out that other people are joining, they're getting married, because I'm human. Okay, I'm a medico, I'm human also, and so I always have this thing कि my friends are partying, somebody's getting married, somebody's doing this, but उस time there was no older person to tell me that dude, like, you have this time and you can it's your choice कि आपने ये choose किया है कि आप 1 year के लिए prepare करोगे. No matter what anybody is doing, if that is aligning with the vision you have for yourself, 10 years down the lane, you do not give, you do not care about what others are doing. तो ये बहुत important है, because when you're studying and you get a picture कि okay, somebody is enjoying, you will open social media. You cannot cut it. You will open, like what we are doing is social media. People are, so this is a distraction for them ideally, but no. If you see social media, if you see a picture of your friends and people are partying and you are studying, so just think that like this aligns with your vision, that aligns with their vision. If they are partying, they want to party, and then they have sorted it all out. And if your focus is this right now, so that when the time is right, you can party, and also you can party along with preparing. I always party and I always study. Good parties, good food, laugh, have like that fun time for an hour with your friends, make something, cook something, and relax, and don't study at that time. So that fear, it should not be there. So these are the 3 points. First of all, analyzing yourself every day, every single day, analyze yourself. At night, exercise, and never have fear of missing out on anything, because you're not.
That's great. Very, very important 3 points, and especially this fear of missing out is something that everybody faces. And thank you for for addressing that. It is something which is very, very important. So I'm sure this session has been really, really helpful for understanding how to appear for NEET and how to manage all the stress, all the overwhelming feelings, how to study, how good is the format these days. And thank you so much, Dr. Sonal, for taking out time today for the whole session. It was really nice. It was really nice, completely in depth, understanding how can a person who is preparing go forward to the whole thing, I'm sure. And in the end, is there anything that you want to add, any motivational quote that keeps you going on an everyday?
Okay. The person, there are so many quotes that keep me going, but I want to customize the motivational quote like the way I like it, which I used again. I always believe in practicing what I preach, so I use this. So when I was giving my MD exam, this quote worked for me best. Again, I was like, I have these few months to really prepare for the exam, since our exams got delayed because of the COVID thing. So I was like, there will be 2 scenarios next year. 2 scenarios. Either I will I study hard, I will perform really well in the end by studying perfectly and with good mind, or I will distract myself, not study, be sad about it, and go in a very negative zone and reach nowhere with no good passing rank or anything in the MD exam. This is what so I felt that how would I feel when, you know, this time has passed and I'm standing there in the face of it next year. उसी time पे 27 June है, तो 27 June 2022 when I'm standing, okay, and I'm in my same room. So what do you want to do? Do you want to sit in the same room with the same people, with the same books, with the same mental state that you cannot go anywhere, and you know, with the same mindset ki you have not performed well? Why? Just because you were not doing the thing that you were supposed to be doing. Or you can have a very good scenario in your head that, you know, you have entered the first year of PG, you know, practicing. There will be problems there also. I'm not saying that's gonna warrant no problems, but at least it will be growth. You know, you have newer problems now, so focus is to every year get some new problems because they're gonna be there. So next year, the problem should be different, and but your approach should be happy. So that works for me, you know, imagining myself 1 year down the lane or 5 years down the lane, or even a day down the lane. You know, tomorrow how I want to feel is how I will plan my day today.
That's really helpful actually, and I'm sure that actually pushes you well to work hard, because nobody wants to be in the same situation again and again. So thank you so much for actually motivating how to think also, because that actually really helps you to work hard. And I'm sure all of the points that you have mentioned, if followed, can work wonders for the students who are preparing. Again, you know, thanking you for taking out time. It was amazing to hear you out, your journey, and how did you prepare for your NEET Pg. Thank you so much everyone for joining us right now. Do share it with your friends and colleagues who are planning to prepare for NEET Pg, as well as who are in that journey right now. I'm sure this will help them a lot to get over the stress, as well as help them to prepare in a better way to succeed well and not to get overwhelmed by the situation, and as well as the examinations. Also, do follow us on our YouTube and Instagram channels as well. There you can find all our old videos that can also help you with your career growth. And thank you so much, Dr. Sonal. It was completely amazing to hear you out and to understand about this examinations. Thank you so much, everyone. Have a nice day. And we will come up with new videos every week. Thank you so much, everyone. Bye-bye.